बराबर Exactly. उसका ये चीज ऑटो रोटेशन
Good afternoon, ma'am.
Good afternoon, everybody. We'll start with the presentation. I request everyone to mute themselves. Good afternoon, everyone. Thank you so much for accepting our invitation and joining us for today's webinar, Eye Contact and Beyond. On behalf of Anshu Center, I am Ms. Aisha Budhani, a behavioral therapist with a background in clinical psychology, would like to warmly welcome each one of you. We are delighted to have parents, caregivers, educators, and therapists joining us today. We hope the session provides valuable insights into a topic that is most often misunderstood and plays a significant role in child's overall development. At Anshu Center, we are committed to creating opportunities for learning, awareness, and meaningful discussions. As part of this initiative, we host free educational webinars every Saturday, led by professions from various disciplines to help parents and caregivers better understanding and support their child's developmental needs. For those joining us for the first time, let me briefly introduce Anshu Center. Anshu Center is an adult and child development center with an urban extension of Kasturba Health Society and Medical Research Center. Located in Vileparla West, Mumbai, Anshu provides comprehensive services for children and adults across the lifespan which support children with neurodevelopmental delays, sensory processing difficulties, learning disabilities, autism spectrum disorders, and emotional and behavioral challenges. Our multidisciplinary team includes occupational therapists, physiotherapists, speech and language therapists, clinical psychologists, nutritionists, special educator, medical professional, and other specialists working together to provide holistic care. Our service include pediatric and adult physiotherapy, occupational therapy, speech therapy, feeding therapy, counseling and mental health care, behavior therapy, special education services, and much more. Our service at Anshu Center, we strongly believe in building a healthy, informed, and empowered community. Our vision is to excel in service, expand in love, and advance in knowledge. It is now my pleasure to introduce our speaker for today's session. Dr. Vithika Rai. Dr. Vithika Rai is a physiotherapist and a feeding therapist at Anshu Center. She is known for her clinical expertise, compassionate approach, and dedication to support children and families through evidence-based therapeutic interventions. Today's topic explore a fascinating aspect of children development. While eye contact is often viewed simply as a communication skill, it can reveal much more about a child's attention, sensory processing, and emotional regulation. Through this session, we hope to gain a deeper understanding of how eye contact develops and why some children may find it challenging. The session will be followed by a Q&A segment where participants will have the opportunity to ask questions and clarify their doubts. We kindly request everyone to keep themselves on mute during the presentation to ensure a smooth flow of the session. You are welcome to post your questions in the chat box and we will address them towards the end. Without any further delay, let us warmly welcome Dr. Vitika Rai and hand over the session to her. Thank you, and I hope you have a meaningful and enriching learning experience.
Thank you so much for that introduction, Aisha. Um, just give me a minute. I'm sharing the screen. Good afternoon, everyone. I'm Dr. Vithika. I work at Anshu Center as a neurophysiotherapist. Our topic for the day is understanding eye contact in neurodivergent children, and we'll briefly discuss in all the children how eye contact is important. So, eye contact is one of the most frequently raised concern by parents, educators, and caregivers of neurodivergent children. Common parent concerns are that my child won't look at me, or they seem to look away when I speak to them. Are they not interested in connecting? We usually have parents who come to us when they tell us that, the child is unable to focus, and we feel like our child is not listening to us. But listening and looking is not the same thing. That's one of the major things that we need to first identify, that just because a child is not looking at you does not mean the child is not listening to you. And then we can open up our minds to how our child is communicating with us, rather than just कि वो देख नहीं रहा है हमको या देखना नहीं चाहता है. So one major thing is children don't work on the basis of they just don't want to do it. They mostly are trying to communicate something else when they're not doing something. So the myth is that if a child does not make eye contact, they are not listening. Whereas the fact is that eye contact is one channel of communication, not a reliable measure of attention or connection. Forcing eye contact will not improve a child's social skills. Whereas if a child is not comfortable with the eye contact, अगर उसको safe ही नहीं feel हो रहा है eye contact देने में, तो उसका communication skill और hamper होगा उससे. It will further make it difficult for the child to communicate with you rather than making it easier. Forced eye contact will further increase their anxiety and reduce communication quality. Understanding the neuroscience helps us support the children with compassion. So, coming to what is eye contact? Eye contact is the act of looking directly into another person's eyes, a key component of nonverbal communication. So, even when we talk to each other, if we are not directly looking at the person, or if we are looking here and there because of how we are trained or how our social behavior is, a lot of the times not looking at someone is either perceived as disrespect in our communities, or it is perceived as lack of interest, or it is perceived as the person is not paying attention. So that's a common thing, that you want your child to look at you, but that's not always comfortable for the child. Typically, developing children or infants show social gaze within hours of birth, but that social gaze is not developed because the child's eyes are still developing, but they start looking around within a few hours of birth. The mutual gaze emerges at 6 to 8 weeks, that is 2 months of age. The child, what do you mean by mutual gaze? Mutual gaze का मतलब है कि जब आप बच्चे को देख रहे हो, बच्चा भी आपको वापस देख सकता है. दैट हैपेंस एट 8 weeks. Immediately at birth, the child cannot really see us, but the child starts to identify light and objects moving. So that's how they slowly, start looking at things, but they can actually look at us and understand things at 8 weeks of age. By 9 to 12 months, joint attention, that is the gaze and the attention, that what you are showing, is it the caregiver, is it an object, that emerges at 9 to 12 months, and it's a foundation for language. If you can't look, you cannot learn, and your receptive speech gets affected, like you're not understanding. So looking is actually a first step, even for speech, for learning, for everything. Eye contact plays roles in turn taking in conversation, expressing emotion, regulating interaction, and establishing shared attention. So when you're looking at someone is when you know that when you're expected to talk next. When you're having a conversation, if you're not looking at the person, you don't know what the visual cues that person is giving you. You don't know if you're expected to talk or if you're expected to just listen. So, turn taking in conversation also comes from eye contact. Expressing emotions, regulating interaction, and establishing shared attention all comes from eye contact. Gaze direction, duration, and timing all carry social meaning beyond simply looking at someone. Cultural norms around eye contact vary significantly. Like I said, what is considered appropriate gaze behavior differs across communities. So it is stressful even for adults. Like sometimes you feel like, you are giving too much eye contact, you are giving too little eye contact, maybe you're not looking. So the whole body language changes accordingly. And especially for neurodivergent children and children, this becomes even more difficult. The eye contact in neurodivergent children. So, if there is a child who has autism, direct eye contact often activates threat related brain circuits in them, making it uncomfortable or overwhelming rather than socially rewarding. So, what happens in children with autism is that the same areas of the brain is activated, which activates in your flight or fright reaction. So, they get more uncomfortable with eye contact. Rather, if they can look at something else, they're in a better situation to respond to you rather than directly looking at you. And we'll further see how that can be modified. In children with ADHD, that is attention deficit hyperactive disorder, children may have difficulty sustaining the eye contact due to attentional regulation challenges and not disinterest. So the child is unable to give that much attention for the to the conversation or what we are asking of the child. That's why the child is looking here and there, and not because it's making them uncomfortable. So that's the difference between autism and ADHD and why the eye contact is not happening. In children who just have a sensory processing disorder, eye contact can be sensory aversive. The intensity of a person's gaze may feel overwhelming. At the same time, they might be visually seeking something else, which is why their gaze is on some other thing which is moving, or maybe they're seeking visual movement. That's why they're not able to concentrate at the face of a person, rather than they're looking at an object. Developmental delays. Reduced eye contact may reflect delayed social communication development, not social withdrawal. So, a child with developmental delay will have a delayed head holding, will have delayed sitting. So, they have not learned to give that eye contact or have things in their eye line at the appropriate age. Hence, they're not withdrawing from social communication, but it's just a slight delay, so which they'll eventually get to when their other milestones are achieved. What's important here is that reduced eye contact does not mean the child is not engaged, processing, or interested in the activity that you're giving them. So we need to stop scolding children that you're not giving eye contact means you're not paying attention. If they're not giving eye contact, we need to understand why they're not giving eye contact and then work on it. Context matters. A child may make eye contact in familiar, low stress settings, but not in unfamiliar or high demand environments. So, a child will first probably start giving eye contact at home or in the therapy setting, and slowly we'll have to further work on getting it in schools or in group settings and in new environments. So, it'll go from a comfortable environment to an uncomfortable environment and not the other way around. So now a little bit of neuroscience behind eye contact. So there's a region in our brain called amygdala, which helps with your emotions. So it also is associated with your threat detection center, and it is also controlling the social gaze. So if you see a problem in processing in this area, can easily miscommunicate just normal social gaze uh, to a threat level problem. So the child inherently is thinking of social gaze as a threat. They're scared, they're not comfortable, and they want to look away. So that is the major reason why a child with autism is facing issues with eye contact, is that their amygdala doesn't know that which emotion to emote at that time. They're having a processing issue in that. So, in autistic individuals, atypical amygdala response to direct gaze may explain why eye contact feels threatening rather than rewarding. Processing a face while listening places a high cognitive demand on the brain. Asking the child to look and listen may actually reduce the comprehension. So, while these are two things that a child is struggling with, one is to understand what you're saying, so they have to listen and they have to understand what is being said while also maintaining the eye contact. So these two high demand cognitive tasks are suppressing the child's ability to do either of the tasks. Sensory sensitivities can amplify the emotional intensity of another person's gaze, making sustained eye contact genuinely uncomfortable. So, if the child has an underlying sensory issue, this problem is further amplified by giving an eye contact. Understanding these neural pathways supports a compassionate neurodiversity affirming clinical approach. So, like we discussed, there are various reasons why children are avoiding eye contact. Either it is a sensory overload, anxiety and social pressure, dual processing difficulty, emotional intensity, cultural and personality factors, past negative experiences. So, a sensory overload we have already discussed, where they are uh, overloaded by another sensory input, maybe auditory, maybe visual, maybe movement, maybe smell or taste. In such situations, since they're already struggling with another sensory need, they cannot focus also on eye contact, because that's also a higher order task that is required of them. Anxiety and social pressure. All of us, when we are nervous, we try to look around, we try to find something else, we fidget with our hands, we fidget with our fingers, and we do all of that. So similarly, if a child is anxious, or they have this social pressure of, we have overly told them that no, you have to look at the person's eye, you have to talk to the person, then they try to completely avoid it. Dual processing, again, looking at the face and listening, two very difficult tasks for any child, and to do it together is becomes a challenge. Emotional intensity, so if a person is talking, looking at them and talking about very emotionally intense things, being angry or shouting, then the child will withdraw from it. And the last point, that is past negative experiences. So such a interaction where the child was completely giving eye contact and was screamed at or scolded, the child might just withdraw from the eye contact the next time. Cultural and personality factors. So eye contact and how much to give is very confusing for children depending on the context. And personality wise, some children are introverts and they avoid giving eye contact. Assessing eye contact clinically. So there is no clinical test to check eye contact. It will come out of history only. So we have to see the frequency for which the child is giving eye contact, the duration and the quality of the eye contact, not just presence or absence. Sometimes a child might give you complete eye contact but not speak at all, or not follow the task or follow the command. They're just giving eye contact. Even that is not okay. That the quality of that eye contact is bad. Context matters. Assess across structured, task free play, familiar adults, and novel settings. So you can't just put the child in an uncomfortable position and then expect them to give eye contact. So, where they were, what they were doing, with whom they were, and what tasks they were expected to perform alongside giving eye contact is also important while we take the history. Age appropriate expectations. A 12-month-old baby is going to give an eye contact different from a 4 year old. A 12-month-old baby is not going to give eye contact, listen to the command, and follow it, whereas a 4 year old can. So, the age of the child also plays an important role. Red flags for eye contact is absence of social gaze by 6 months, where the child is absolutely not looking at the parent or familiar people, and no joint attention by 12 months. That means when being spoken to, the child is not able to maintain the eye contact by 12 months, and regression in previously established social gaze, where the child was looking earlier but now is not looking. All of these are red flags when you should contact your pediatrician or your physiotherapist or an autist. You need to get to these people if your children are not doing this. Consider temperament, anxiety, cultural background, and overall communication profile. So, what is the temperament of the child? Was the child in a different mood? Was the child anxious? Was the child in a situation where they were not comfortable? All of this has to be asked to the parent when they come to us saying, eye contact is less. So, how does this come up in their functional communication? So if your joint attention is not there on an object or an event, it is a stronger predictor of language development than eye contact alone. So if you're not able to pay attention, look at people, it's going to hamper your speech and language development in the long run. Your social reciprocity, your ability to make friends, the social behavior cannot develop if you don't give eye contact. Language development correlates more closely with shared attention, imitation, turn taking than with just sustained eye gaze. So the speech might still develop if you don't have eye contact, but your social communication will be more affected. Play skills. Children with limited eye contact can demonstrate rich symbolic play, cooperative play, and pretend play, but they will not be able to play in a group. Functional communication, like expressing your needs, commenting, responding, can be fully intact without typical gaze patterns also, but it will mostly be with their familiar people. In a strange environment or a new environment, the child might struggle with it. Therapy goals should prioritize functional communication outcomes over normalizing eye contact behavior. So, what we want to say by this slide is that the child might be able to completely function without giving eye contact, but there are certain higher order things for which the eye contact is needed. Should we force eye contact? So, potential drawbacks of forcing eye contact is it increases anxiety, reduces processing capacity, and creates negative associations with social interaction. So, the child in the long run might completely withdraw from all social situations just because we are forcing them to give eye contact. Research shows that autistic individuals who suppress natural gaze patterns to perform eye contact experience significantly higher cognitive load and stress. So, whose their natural instinct is to look away, but we are forcing them to give the eye contact, which is further causing them a load and excessive stress of giving the eye contact. Compliance versus connection. So, a child who has learned to make eye contact because it was forced upon them might be compliant, but they're not forming connections. They have just learned to, I have to give eye contact, but they are constantly thinking of compensatory strategies, and they can't form those connections because they're not very present in that situation. Neurodiversity affirming perspective. So, respecting a child's natural communication style promotes trust, anxiety, reduces anxiety, and leads to a better functional outcome. And in the long run, you can, once you have that trust with that child, you can talk to them about eye contact and how to slowly develop it from there. When to gently encourage the gaze in the context of play and natural interaction, and never as a demand or precondition for being heard. So you can't tell the child that you look at me or else I'm not talking to you, but you can definitely tell them, oh, we are playing peekaboo, can you look at my eyes, can you uh, auntie is talking to you, can you say hi, can you look at her face and wave at her. But you should not tell the child that if you don't wave at her by looking in her eyes, she'll not talk to the child. Clinical recommendation, it supports social connection and engagement, not conformity to neurotypical eye contact norms. So we have to prioritize the social communication and connection rather than just forcing them to look at every person's eye at all times. Strategies to encourage social connection. You have to position yourself within the child's natural visual field and get down to their level during interaction. So this is something we always tell parents even in the sessions, that we have to sit at their level where they can look at us. We can't expect them to look at us from far or follow commands from far. So you have to sit at their level and then be in their vision field, and they will eventually look at us. Face to face play, so peekaboo or blowing bubbles, gently rough housing, like you're playing something, where's your eyes, where's your nose, a little bit of touch, and you can integrate the tactile activity with your eye contact. But rather not demand, like you, if you tell a child, look at me, look at this person, or look at my eyes, there is a lesser possibility of the child doing it, whereas if you are playing with them and it's a natural part of play, they might do it more easily. Interactive songs and finger games, predictable rhythm and repetition draws children's attention to the face naturally. So if you're singing, they are going to look at your lips and eventually look at your eyes. So interactive songs will help them do that. Turn taking activities, that is passing objects, rolling a ball, building together, like blocks or clay activities, creating expectation and shared attention will also help. We have to leverage preferred interests, like following the child's lead builds connection and naturally draws gaze. So you let the child decide what we have to do, and in order for them to explain to us what we have to do, they'll have to look at us and show us how to do it, which is when their joint attention will come, and then they'll look at us. You have to build shared attention first. So once the child is engaged and regulated, social gaze often emerges naturally. Reduce sensory demands in the environment to make face-to-face interaction more comfortable. So what can we do in different age groups? So if the child is between 0 to 2 years, face to face play, peekaboo, singing face to face songs, mirroring facial expressions, cause and effect toys with face interaction will help. Preschool children who are able to understand simple commands, we can give them bubble blowing, face level songs, and songs with anticipation where they know what the next thing is, turn taking in simple games, puppet play, mirror play, and action songs. School age children, that is 5+ years, social stories about interaction, videos you can show them where people are, giving eye contact, and if you don't give eye contact, how the person in front of you feels. Role play in a low pressure context, so preferred interest conversations and drama activities. All age groups prioritize child led interaction rather than forcing anything on them. Wait, watch, and follow the child's lead before initiating it. Key principle is all activities should be embedded in natural, enjoyable context. Never use eye contact as a reward or requirement for participation. It should just be in their natural playtime. Document progress, use functional outcomes like, turn taking, joint attention, and response to name rather than just eye contact counts. Home based activities which parents can follow. You can check for your daily routines, bath times, meal times, and dressing routines are natural opportunities for face to face engagement. You can read to the child. While you're reading, the child is looking at your face because they cannot read and they cannot go through. So they're looking for cues from your face. So that's again a natural opportunity for the child to look at you and give eye contact. Peekaboo and anticipation games, pause before the surprise. This naturally draws the child's gaze to your face. Play based activities, follow your child's lead into their play set at their level. Make yourself a part of the activity rather than just telling them what to do. Singing and nursery rhymes, songs with actions, pauses, and repetition naturally invites the social gaze. Uh, when to seek professional help? Seeking professional assessment is needed if there is no social smile by 3 months, no babbling or pointing by 12 months, regression in communication skills at any age, additional concerns such as, absence of attention, delayed expressive or receptive language, limited social engagement, and beyond eye contact. Professionals to consult are pediatricians, speech language pathologists, occupational therapists, and developmental psychologists. Key messages what we learned from today's webinar is that eye contact is one aspect of communication, not a measure of child's intelligence, affection, or potential. So you cannot take eye contact to be a very thing, like it's not like a child is disrespecting you, or not, the child doesn't love you, or there is no, there's some problem with their intelligence. It's just one aspect of their communication. Social connection is more important than eye contact alone, so we have to focus on meaningful interaction rather than forced eye contact. Children can be fully engaged even when they are not looking directly at you. You have to focus on the interaction and the quality of the interaction, not compliance with neurotypical gaze norms. So,
So,
we have
we've
come
come
to
to
an
an
end
end
of
of
our
our
webinar
webinar.
here, and I think we can open the space for questions now.
If any of the parents or someone has questions, they can put up in the chat box or you can speak now. Okay. So, as we come to the end of today's webinar, I would like to express my sincere gratitude to Dr. Vithika Rai for sharing her valuable knowledge and expertise with us. Thank you, Dr. Vithika, for helping us to look beyond eye contact as merely a communication skill and understand its connection and with attention, sensory processing, and emotional regulation. Your insights and practical strategies have provided us with a deeper appreciation of how meaningful connections are built and supported in children. I would also like to extend a heartfelt thank you to all the parents, participants, and therapists who are present here today. Your participation, thoughtful questions, and willingness to learn are what makes these sessions impactful and meaningful. We hope today's webinar has provided you with useful knowledge and practical takeaways that you can apply in your interaction with children, whether at home, in classroom, or any therapeutic settings. As a reminder, Anshu Center will continue to host free educational webinars every Saturday featuring experts from different disciplines. We look forward to welcome you to our future sessions and continuing this journey of learning. Thank you once again for your time, participation, support. Have a wonderful day ahead. We hope to see you again.
Thank you,
Thank you,
Aisha.
Aisha.